Good morning, RadTech students from Century College. This is Ashley reporting from Channel 9 News. I am here showcasing the new ultrasound department at Woodwinds Hospital. Here with us is Eric, one of the ultrasound techs in the ultrasound department. What can you tell us about ultrasound?
Well, ultrasound is a non-invasive imaging technique generated from sound waves from the transducer. Then they're reflected back from the organs and tissues that is analyzed and visualized on the computer screen.
Well, thank you, Eric, for that insight on ultrasound. But I have one more question. What does the future hold?
Knock knock. Here we are, Lucy. We made it to ultrasound.
Hello, I'm Eric, the ultrasound tech. Is it okay if Channel 9 News watches your exam?
Yeah, that's fine.
Alright, Lucy, let me help you get up the table here. Zach, you can have a seat right in that chair.
Oh, thank you, doctor.
So, Lucy, what kind of symptoms are you having?
Well, I have some abdominal pain and just some bleeding.
Okay, well, I'm going to go ahead and do an abdominal scan. Usually we do a transvaginal scan, but you're far enough along where we can just do it externally.
Well, why are we doing an ultrasound for? Don't they usually do x-rays?
Yeah.
Well, it's a non-invasive procedure. It doesn't require any radiation, and it's low cost.
Okay.
So, warm gel here. Oh, that's a nice ring you have.
Yeah, we just came back from our honeymoon.
Yeah, we were in Maui, newlyweds.
Oh, that's nice.
So what are you seeing on the screen now?
Well, you can see the uterus right here, and this is just a preliminary picture. But I'm going to grab the ER doc.
Is something wrong?
Oh, I'll just be right back.
Okay.
I'm worried.
It's alright, honey. They're just grabbing the doc. It's okay.
Alright. Baby, I'm worried.
It's gonna be alright, honey. I brought you to the best hospital. You know, I paid for everything. A best ring.
Here's my
all that
preliminary
stuff.
scan. I just wanted to take a look at this.
Alright, let me take a look here. Well, it looks like we have an ectopic pregnancy here.
What's that?
Well, it's when your developing embryo doesn't attach to your uterine wall and instead it attaches to your fallopian tubes.
Is the baby gonna be alright?
Well, in this case, the baby won't be able to be carried to full term.
Is that dangerous, or what happens after that?
So what are
Well,
we gonna do?
there's two options. One is to treat with a medication, which we will be able to do in your case. But if we let the baby continue to grow, your fallopian tubes could burst, and it would lead to surgery, and you would lose the baby either way.
Breaking news from Channel 9 News. Obviously, this is a sad ending for this happy couple that just found out that they were pregnant, but the pregnancy ended up being ectopic and has to be terminated with the medication called methotrexate, which will terminate the pregnancy. But the good news is they will still be able to conceive, and they will be getting busy soon. But one more question for you, Doc. So how often does the embryo develop in the fallopian tube?
Well, 98% of the time the embryo is developing in ectopic pregnancies in the fallopian tube, but there is a 2% chance where it could develop in either the ovary or the cervix.
And so if it's not terminated and the embryo keeps developing in the fallopian tube, what will happen?
Well, since the embryo will continue to develop and grow, the fallopian tubes aren't big enough to hold that, so eventually it will burst, and this causes a great risk to the patient. They'll have severe abdominal pain, vaginal bleeding, and usually it results in a emergency surgery.
Okay. So, and for you viewers at home that want to become ultrasound techs, maybe Eric can tell us how we can do that.
Well, it's 2 years of schooling. The average pay is about $68,000 a year, so it's a great job.
It does sound like a great job. And now back to you, Century College. Take it away, Diane.
Normally, a fertilized egg implants in the uterus. But if the fertilized egg implants somewhere other than the uterus, the pregnancy is said to be ectopic, which means located in an abnormal position. When an ectopic pregnancy occurs, the fertilized egg usually implants in one of the fallopian tubes. Because the fallopian tube is narrow and its walls are thin, The pregnancy only has to be about the size of a jelly bean before the fallopian tube bursts, causing major bleeding. Occasionally, the fertilized egg may implant on an ovary, in the abdominal cavity, or in the cervix. Ectopic pregnancies are rare. They occur in about 1 out of every 60 pregnancies. There are certain risk factors that make an ectopic pregnancy more likely. These risks include a history of pelvic inflammatory disease or PID, sexually transmitted diseases such as chlamydia or gonorrhea, a previous ectopic pregnancy, or a previous tubal surgery for infertility. Treatment of an ectopic pregnancy, either medically or surgically, is necessary to prevent serious, even life-threatening complications.
Hello, Mr. Jones. My name is Dr. Andrea. What seems to be the problem today?
Well, I had to come in today because my nuts are kind of, I guess you'd call them testicles, but they're kind of swollen and I'm having a lot of pain, just sick to my stomach.
Really? Okay, how long has this been going on for?
You know, I was working out this morning and went for my jog and came home and it's just been hurting ever since.
Really? Okay, alright. Well, I think first what I'm gonna do is we're gonna have a look at them, if you don't mind.
Gotta do what you gotta do.
Alright, thank you, sir. Alright, so I'm just gonna cover you up a little bit here. Alright, let's see what we have. Alright, well, they're definitely a little swollen and red there. In cases like this, what I usually go about and do is order some labs to be drawn, and then we're going to actually order an ultrasound too.
Well, what do you think it is? Because I got stuff going on tonight.
Well, I understand that. Unfortunately, without those labs, first we're going to have to order those, but I think it might be testicular torsion.
What is that?
That's actually where the testicle will twist on itself and it'll actually cut off the blood supply to one or both of your testicles. So that's pretty dangerous. We want to get that looked at right away. That's why I'm really suggesting that ultrasound.
Could it be anything else? Because that...
There are possibilities. Some of your symptoms present the same as like an appendicitis or a hernia. Same with epididymitis. 2 of those are infections, so that's why we're going to draw your labs. Another one, the hernia, can also be demonstrated with an ultrasound too. So that's why it's important to get that. Want to take a break?
Yeah. So, ultrasound, why not X-ray or CT?
Well, those tests don't really show the blood flow, which is pretty important right now. There is another test that would show that. It would actually be a nuclear scan. That would involve them injecting some radioisotopes into your bloodstream. I can already tell you're not for that, and I am not either. There's a lot more radiation. Ultrasound doesn't require any radiation. Also, it's cheaper, and I know you probably like that too. So I feel that one test is just completely unnecessary, whereas ultrasound will do a better job of showing the pathology that's going on right now.
Well, you sound like you know what you're talking about, so we'll go with that.
Alright, I'm going to go get our ultrasound tech right now.
Hi, I'm Lucky. I'm the ultrasound tech. Alright, so I'm gonna go ahead and do the exam here, alright?
Is this okay for you?
This is perfect. Alright, now I'm just gonna put some gel before I start the test here.
It's warm.
Alright. Now I'm gonna put the transducer on there and then it'll allow us to visualize. Ouch. Alright. Now if you take a look right here, on the right one, there's not really that much blood flow here, but on the left one you can see these lines here. These are kind of like the blood flow that you can see still flowing here. And the right one has nothing. Have the doctor take a look at this, okay?
Well, Mr. Jones, by the looks of that blood supply, a lot of times we are able to adjust these manually, but I am going to recommend surgery for this. There's quite a severe stenosis in that spermatic cord.
And that's the best
Yep, we got a good team of surgeons, and they'll actually get you in right away. It's important to fix this right now. We can actually probably save your testicle.
All right.
Go Team Venture! Testicular torsion isn't just something on TV. It's a real problem.
Testicular torsion occurs only in males, usually under 25 years of age.
If you're experiencing sharp pains in the scrotum, swelling in one or both testes, or even blood in your semen, your genitals are most likely dying.
That's right, Doc. So if you want to keep them, you need to seek medical attention as soon as you experience pain, like Hank and Dean here did.
So don't be a jackass. Go see a doctor.
If you want to keep your testicles healthy, remember these 3 words. Stop, touch, and tell.
To find out more about testicular torsion, you can look in special medical books.
Or on the interweb.